I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video on lower eyelid basics. Patients come in and they seek lower eyelid aesthetic, cosmetic, surgery, whatever you want to call it, and they say, I want a blepharoplasty, although most people don't know what a blepharoplasty is. But the lower eyelid blepharoplasty generally means change, improve, restore, rejuvenate the appearance of my lower eyelid. So why would you want it? What's going on? What changes? The changes are multi-layered. They're not one thing. They're changes to your eye, the tissue around the eye, the eyelid, the face, the lower face. All of that exerts pressure, changes on the lower eyelid, and the lower eyelid drops. It has a very specific evolutionary role, and it has to move upwards. Your skin loses elasticity, it stretches, the muscle drops, the fat atrophies, it all pulls down. Also, the fat behind the eye tends to therefore become more prominent, which appears as the bulge. So the basics are, why does this happen? It happens because of skin-related changes, but also there's things you need to be aware about that you do. One of the most common causes is this: rubbing, stretching. People are always doing this, stretching their skin. And the more you rub, the more you stretch, the more tricky it is for me to fix it. I need good quality tissue. When you've got stretched tissue, your outcomes are not going to be as good. That's the first thing. Second thing is weight fluctuations. If you've got a lot of weight on your face, you're going to pull it down further. If you want it to go back up and you've got a lot of weight on the face, it's very hard to do because I've got to counter all this weight and I can't with this little bit of tissue up here. So manage your weight. Obviously your diet is huge with your skin integrity is very, very important to minimize all that over time. But rubbing is the key issue, to the point where I can actually look at a patient and go, you rub this side more than this, we're going to have some issues here. It's very, very, very important. Now, something else that's important is that often people think that by removing a bit of skin, things will improve. Guess what happens? You remove skin, you'll actually bring the eyelid further down. It's not a skin problem, although skin removal is part of the surgery. That's not where the pathology lies. So that's the basics of lower eyelid blepharoplasty, and the take-home message is, please don't rub before or after surgery. Before, you maintain your youth by abstaining from rubbing, your nutrition, your diet, alcohol, exercise, smoking. After, if you rub, it'll all come down. So I hope that all makes sense. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.